There's an inequity in healthcare. People that live in remote and rural locations don't have access to the facilities that we have, say, in Vancouver. So it's important to bring this kind of research into the communities because you can't bring the communities to the research.
The name of this research project is called A Strong Breath, and in Carrier, it is translated to Bayis Ilh Tus.
The mandate of Carrier Sekani Family Services is to provide health and social services to the 11 member First Nations within the North Central British Columbia area.
The purpose of this project is to estimate the prevalence of chronic obstructive pulmonary disease in a number of First Nations communities, doing lung function tests with the people, and also measuring air quality in their home.
Primarily, I do the lung function testing on the participants, but I'm also involved in the home sampling as well. I like the travel. I like going into the communities. They're beautiful. A typical day for us would be leaving Vancouver at about 7 in the morning, getting to Prince George about an hour later, get a car, get our equipment, drive to one of the reserves, whichever one we're going to be working with, check in at the health center. We rely on Benna to find participants for us. She is our cultural liaison, and she's very valuable on this survey.
I do the interviews, and the interviews are about 45 minutes long. The most important thing to me is to have respect for community members and to gain their trust so that they can be open and honest when you're asking them questions.
We didn't just arrive in the community and start taking lung function measurements. It started with a fairly long community building engagement process. We talked to community advisory boards and got their perspective of, is this an important question? What would the research actually look like? The advisory councils, they're crucial. They're crucial for projects like this. These are studies that ask a lot of personal questions. We're going into people's homes. Carrier Sekani Family Services' role is to make sure that the research is being done in a good way, that the research is culturally safe, it meets the needs of the community, and it follows First Nations research principles.
None of this would happen without our advisory committee, and that advisory committee is made up of members of all of our member nations. The important thing for Carrier Sekani Family Services is really about access to health services. So this project was really about getting spirometry out into the communities that we serve. Spirometry is a very simple breathing test that can detect if someone has some kind of restriction or obstruction in their airways.
A lot of our community members are suffering with different ailments, and lung health is one. Most people, when you're interviewing them, because our community members have been interviewed to death and surveyed to death and researched to death, most people would like to see results.
By getting more information and understanding how many people have a condition, it allows for Carrier Sekani Family Services to be able to bring in the kinds of assessment and treatment care that people need. It's definitely a strengths-based approach to research. BC Lung provided the first operating grant for this particular project, and that launched us to be able to apply for the much larger grant that continued the work. So it definitely was the springboard that allowed the larger project to happen.
We have 5 years to actually complete this work in all of the communities. The key to Indigenous research is that from the onset there is something like the spirometry testing that is a direct benefit to the community, so it's not just research for research's sake.
We're both stronger together. UBC and Carrier Sekani Family Services work well together, and it makes this project happen.